Hello, let's talk radiation therapy. Did you know that there was more than one kind of radiation therapy? I didn't until a friend of mine who was just diagnosed with breast cancer told me that she was looking into proton therapy and that she had to go down the road for that. I had no idea, and so I had photon therapy. The difference between proton therapy and photon therapy is interesting. Proton therapy uses protons at accelerated high speeds and are directed directly at the tumor. Photons radiation uses high energy X rays. Um, so, for proton radiation, the protons deposit most of their energy at a specific depth known as the Bragg peak, with very little radiation beyond that point. Its advantages are that it's a very precise targeting of the tumor, and therefore you have reduced radiation exposure to healthy tissue and potentially fewer long-term side effects. Disadvantages of the proton therapy are that it is more expensive than photon therapy and its availability is limited compared to photon therapy. And the RBE, or relative biological effectiveness of protons, can vary, making precise dose calculations very complex. And if you were to Google proton radiation therapy versus photon radiation therapy, there is a link to NIH about the relative biological effectiveness. I'm not going to go into that. Photon therapy uses high energy X rays directed at the tumor, and the photons deposit radiation as they enter the body, continuing through to the exit point. The advantages of photon therapy is that it is more widely available than proton therapy and therefore generally less expensive. The disadvantages of the photon therapy is that you have more radiation exposure to healthy tissue and can cause more side effects. Speaking for me, I had a double mastectomy, and the cancer side, the radiation side, the scar is much thicker than on the right side, on the left side. So I'm going to show you. So there's my radiation side. You can see a little indentation there. And I think you can kind of tell that the scar is thick versus the non-radiation side. It's very nice and smooth, and the scar is not thick at all. And the surgeon always told me that there could be a difference in how my body healed from the right side to the left side. And it did heal differently. Another question to find out the answer to is, will your health insurance pay for proton therapy? So I Googled, does health insurance cover proton therapy? And the answer was that most private insurance plans, as well as Medicare and Medicaid, typically cover proton therapy, particularly for certain cancer types or on a case-by-case basis based on medical necessity. Studies have shown that 87% of patients ultimately gain approval for proton therapy, though only 30% of commercial plans initially approve it. So, Medicare will generally cover proton therapy, especially when conventional radiation therapy cannot spare surrounding healthy tissue and when the treatment offers an added benefit to the patient. If proton therapy occurs during a hospital stay, it falls under Medicare Part A, and if it's outpatient or in a freestanding clinic, it would fall under Medicare Part B. Commercial insurances coverage is common, but it does require prior authorization, as does much of cancer treatment anyway. Each insurer has specific policies and guidelines for assessing coverage requests and determining medical necessity. Some plans may cover proton therapy only for specific diagnoses, like childhood cancers or certain ocular cancers, or consider it on a case by case basis. Initial denials are possible, but many patients are successful in appealing these decisions. According to Fred Hutchinson Cancer Center, only about 15% of their patients receive an initial denial, and almost all patients choose to proceed with treatment even after an initial denial because their appeals coordinator may help them secure coverage. Medicaid may cover proton therapy depending on the specific state and plan. So I hope that this information was helpful to you and at least thought provoking and caused you to do some research further on your own if you're facing radiation therapy. Um, Take care and be healthy. Have a great day. Bye.